Good morning, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Today we look at frozen shoulder, tennis elbow. These things are quite common. And tennis elbow doesn't often have anything to do with playing tennis.
Yes.
So please inform us.
See, it's mainly the rigidity or the spasm of the musculoskeletal network around the joint, especially the shoulder joint, where it starts getting frozen. Frozen in the sense the movements are restricted, especially the abduction, or even the person won't be able to even lift his upper limb like this. So this is what frozen shoulder means. It can be on one side or it can be on both the sides. Mainly the management is just to gain the tone and the plasticity in the muscle fibers and ligamenture around the joint. This is in general. Same thing applies to tennis elbow also. We call it tennis elbow because while playing the tennis, people get
Often
this type
get
of
that, yes,
elbow.
yes.
But that again is what we call, it's like a sprain or a wrong type of use people get in the elbow and they develop pain, whereas they even just can't hold anything in hand. That much painful. Even frozen shoulder also can be very much painful. I have seen people even they wouldn't be able to even negotiate the while putting on the shirts. They couldn't put their limbs in sleeves while wearing their dress. So it can be very painful situation, the frozen shoulder. It's a chronic thing. One won't have frozen shoulder within a day or so. So it goes on getting built up and finally then person lands up in frozen shoulder. In frozen shoulder cases, we recommend that somehow it has association with diabetes. Many instances are there where the person had unexplained shoulder pain with the diagnosis of either frozen shoulder or periarthritis of the shoulder joint. And we tested blood sugar and it can be one of the indicator. There is no explanation that why it is associated, but we have seen so many cases of diabetes are presented as frozen shoulder or periarthritis of shoulder. So we rule it out and then explain the person the whole genesis of frozen shoulder, and we ask them to manage it properly with little bit of physiotherapy and general management. In general management, we see that the person has ample of vitamin D3, which again we ask the person to have sun bath for vitamin D3. And when there is adequate supply of vitamin D3 in body, the calcium metabolism also becomes efficient. And then the muscles and ligaments, they get enough strength as well as they get very good quality of tone and that elasticity. And then we advise simple exercises. Those exercises are very simple. So we just ask the person to sit erect, keep their neck erect, and they just retract shoulders backward like this, and again release it. Again retracting backward. This is one exercise. There is another exercise what we call oscillation, like pendulum. So I can just demonstrate how we do
Surely.
it. So like earlier old wall clocks were there having the pendulum
Oh, yes.
oscillating. That type exercise we advise person to do it. So person has to just stand up, stoop little bit in straight line, and with this upper limb, suppose this shoulder is frozen, then we ask the person to keep it straight and then start oscillating. Start oscillating without flexing here, and that amplitude can be increased slowly so much that here the person gets straight. Then we ask to change the plane. So like that in different plane with both the sides, person has to undergo this exercise, and that also releases slowly. Plus we have a remedy like a plant, rustox. If you have heard, rustox is a plant, rustoxicodendron. So that plant, if we mix with mustard oil, that extract mother tincture, and have a light massage on frozen shoulder, that also releases the spasm. And slowly in the course of say 2 months or 3 months, the frozen shoulder gets reversed
So
completely.
you don't have anything internally. You don't give anything internally.
If internally there are constitutional remedies, not necessarily for frozen shoulder. For homeopathy, what we do is internally we always give a remedy which is constitutional, based on the whole totality. Like how is the appetite of the person, what are the cravings and aversions and mental
But not
disposition.
specific to
Not
frozen
specific
shoulder.
to frozen shoulder.
Okay. Wonderful. Thank you.